Aging and Long-Term Care Committee. For the record, we do have a quorum. Welcome, Commissioner. Thank you so much for coming to this morning's hearing to give us an update on the COVID vaccine rollout. We all know that this virus has hit our seniors the hardest, and I am so worried about our seniors right now, and I'm really worried that they're getting left behind again when it comes to the vaccine. It's been almost 9 months of complete fear-filled lockdown for them, not to mention the loneliness and depression and isolation that they've been going through. They want to get their life back to normal and not be in constant fear that they might die. Almost 90% of our deaths have been Minnesotans over the age of 65. They finally see the light at the end of the tunnel with the vaccine here. The governor said that he's prioritizing our seniors. I just don't feel that his words match his actions. The vaccine has been here since December 23rd, but seniors are only getting a small percentage of the doses that the state has received up to this point. And this just can't continue. I've received thousands of messages from folks across the state. I printed some of them off to read, but we're not going to have time for that. And I'm sure many others on this committee have received Facebook posts and emails and phone calls and text. Seniors again feel like they're not being prioritized when they see the other younger, healthier people getting the vaccine ahead of them. We all know that seniors are the most at risk of losing their lives to the virus, and they should be the first one to get the vaccine. The governor has said many times that he is making his decisions on the data. So I went to the MDH website and got the data that was meaningful to this committee and to our seniors. I just want to bring up a few of the slides with this data before we begin. And I think we're going to share the screen here. I just have 5 slides. There we go. And these aren't fancy slides because it's a simple little PowerPoint and I didn't have any graphics people to do anything. So it's just spending some hours yesterday pulling this data together. Oh, there it is, Suze. We can just go to slide number 2 and I'll start talking and you can figure out. Okay, so this is, and I had to kind of go through the MDH website and pull these numbers because it's not all organized how I would want to see it. So I just did it this way. Right now, as of January 21st, according to the MDH website, we've lost 6,011 people to COVID-19 deaths, 5,380 of them have been 65 years and older. So almost 90% of our deaths have been those 65 and older. And of those 65 and older, 63% of those people of the total have been living in long-term care and assisted living, 3,877. And then there's the other stats below. And as you can see, almost 98% of them are 50 years old and older. And then if you go to the other box down there, when it comes to our vaccinations, the website is only updated to the 24th, but I went all the way up through yesterday. We've got 350,000 vaccines total that have been given out, at least one dose. 74,721 of those have been seniors over the age of 65. So that's a 21% of the total number of vaccinations have been given to our seniors 65 and older. And Minnesota has a population of seniors over 65 of 918,125. So that means the vaccinations that we have and that have been given out, only 8% of Minnesota seniors 65 and older have gotten this vaccine. So that's a stat I feel that when the governor says that he is prioritizing seniors and using the data that I have shows that seniors are not being prioritized. The next slide is just the number of COVID-19 deaths starting from March 21st all the way through January 21st, and you can see how the numbers have been growing. The next one is demographics by age, and the brown line are those proportions of deaths, highest proportions of deaths in the state of Minnesota. And as you can see, I mean, once you get to 75 and older, that number just skyrockets. Your risk of dying from the virus are that much greater. And you can see also that those under, ninth grade and under, their number of deaths is not there. But so even today in St. Paul, there's the event where they're taking 16 or 15,000 doses and giving to teachers and childcare workers. And yet those are not going to our seniors. And I guess one of the questions, and I'll ask this later today, and it was an article that just came out that 4 states are actually taking the vaccines that, and I'll ask you this, so just put it in your mind, are taking the vaccine that's sitting in storage and it's not going to the seniors over 65 or our long-term care facilities, and instead going to our education workers. The next slide was one of the slides that was from the presentation January 6th. And now I think the phases have changed a little bit, and 1C has moved into 1B. But that furthers my point in that the vaccines are being diluted by other sectors, the education sector, food and agriculture, utilities, transportation, like younger, healthier workers, when again, our most vulnerable, our seniors, are only getting 8% of the total vaccines out there. And just going forward, if you're a senior, that's very, very disturbing and disappointing when this whole process of getting the vaccine and the huge wait at the website or on the phones, and the site crashing, and then having to drive long distances to get the vaccine, and then seeing on the news that there's prisoners getting the vaccine, or now an event at Roy Wilkins where, again, younger, healthier workers are getting them, who are not as extreme risk as the seniors. And the last one I want to talk about this later in the presentation is the pilot program sites. How were those decided? Why were those decided when we see around the country other states doing it much differently and much more conveniently? You can, in Ohio, walk into a Kroger's grocery store, in and out in 5 minutes, and get the vaccine. Arizona, you walk into a Safeway grocery store, and they're also giving them around the country at long-term care facilities. While they're actually at the long-term care facility giving the vaccine, the public not living in the facility can get in line and get the vaccine. And instead, we've got these pilot sites, and I'm sure Senator Rood's going to talk about it, because that big empty area right there where her folks are, in her emails she's getting, people have to drive a long way to get a shot. And the governor said in his press conference the other day that it's going to be late spring for younger folks to get the vaccine, but then they'll all be able to go to their clinics or pharmacies to get it. So my question will be later, why can't seniors just go to their clinic or their pharmacy and get it? Why does it have to be so complicated? So the governor also said there's not enough vaccines in the state or the country or the world to vaccinate everyone, which is the absolute reason why we need to prioritize our vaccines and make sure that our seniors are getting them first. So that's the end of my slides. So let's see. With that being said, the vaccine has been in Minnesota since December 23rd. And in just this last month, we have lost 1,210 seniors, 1,210 seniors living in long-term care and assisted living. And that number is only counting long-term care facilities, not our total population of 65 and older. I couldn't get that data, how many have died since December 23rd. Every day that goes by without getting the vaccines into the arms of seniors is a matter of life and death. While the federal and state advisory committees are making general recommendations, it's solely up to the governor to make the final decisions of which Minnesotans are prioritized. I cannot beg the governor enough to reevaluate his data and change his mind on who gets the next round of vaccines. As more vaccines become available into the state and in future rounds, they should all have the seniors prioritized. Commissioner Malcolm and Governor Walz, I'm begging you to please put every senior that wants the vaccine at the top of the list. Thank you. Thank you again for coming. And I will turn the floor over to you, Commissioner Malcolm.
Thank you, Madam Chair. Good morning, members of the committee. Well, Senator, we certainly agree with you that our elders need to be prioritized, and indeed they have. In phase 1A, which we are working to complete right now, as you know, the priority in phase 1A was all healthcare workers, the people that need to take care of all of us, seniors most certainly included, when people get severely ill enough to need hospitalization. So that, as you know, was the first tier of healthcare workers were hospital-based workers taking direct care of COVID patients, of whom, as you say, the majority are seniors. Also, at that same time, concurrently with that, the first phase of 1A were the residents and staff of skilled nursing facilities and then assisted living facilities. There's been significant progress in recent weeks on that front. We'll talk about the federal pharmacy partnership program, a direct contract, as you know, between the federal government and 3 large chains who have contracted to do the vaccination in skilled nursing facilities and assisted living. So we can talk about how that's going, how many people have been vaccinated. But I just really want to reinforce, I think you would agree, Madam Chair, that the importance of vaccinating the healthcare workforce to take care of people when they get severe illness is also a priority. And so healthcare workers, long-term care residents and staff have been the first priority. We're working through that population well. But the governor did expand 2 weeks ago the eligibility for all people over age 65 to get vaccine, and that has been a priority. Certainly, we'll get more deeply into all of those data and know that you are most interested in vaccine, and to whatever degree you want. We can also talk about kind of the overall situation with the pandemic. You watched, as we did, all the very hard-won progress over the summer and fall with long-term care cases and deaths coming significantly down. We watched that progress start to erode in October and November as cases spiked all over the state and got back into the long-term care facilities. I'm really happy to say that those cases have come back down from their peak. And we are now once again, among one of the lowest states in the nation in terms of cases per 1,000 skilled nursing facility residents and deaths per 1,000 skilled nursing facility residents, the best apples to apples comparisons that we have. But I couldn't agree with you more that vaccination is the key to returning to quality of life and normalcy for the residents of long-term care facilities and their families and their staff. Certainly, we know the most vulnerable, particularly in Minnesota with our robust home and community-based services, our most vulnerable seniors are in these congregate care settings. And that's why that was the first. But absolutely, seniors living in the community are a high priority. And we are working hard with healthcare partners, community pharmacies, and others to expand the places that everybody over 65 can get vaccination. We, in fact, have some very positive news we can share in terms of our ability to start being more nimble with some of the doses that have been restricted until this point for those congregate care settings. I do have my colleague, Catherine Blauvelt, is with me this morning. She's been leading a lot of our operational efforts with respect to vaccine. So we've got just a few slides. We'll go really quickly because I know you have a lot of questions, just to give you an update on where we sit with the over 65 population. Thanks, Madam Chair.
Thank you, Madam Chair, members of the committee. I will just step through a few slides and turn it back to the commissioner. So just a few, to the commissioner's point, there is a lot happening. Try to move through and move vaccine to our most vulnerable. So you'll see here some recent actions that the state has taken. I'm sure you folks know about our dashboard and the goals to get vaccine into Minnesotans' arms, 72-hour and 1-week goals. And we have also instituted a more orderly and equitable registration process for our 65 plus folks at our pilot clinics. And of course, that happened yesterday. I'm happy to report on the details, but the long and the short of it is that went very smoothly for Minnesotans yesterday, both on the web and in the call center. We had very strong pre-registration and are really looking forward to doing that randomization to select folks to receive shots next week, or this week rather. Next slide. All right, so just following up with some more detail, we have indeed, and MDH has for 2 weeks now not allowed, but enabled hospitals and healthcare systems, anyone who has vaccine, right, to provide that vaccine to 65 plus. So to the earlier question around making it available, it is available with healthcare providers and pharmacies that have doses available. And of course, they are dealing with limited supply with a lot of demand. There's over 900,000 folks in the state that are 65 and older, right? We only get around 60,000 doses a week, give or take. So with that, as I understand it, healthcare providers are figuring out how to notify folks that could receive that shot, right? So, asking people to get that notification. Next slide, please. So an update for you on our pilot vaccination clinics, a really successful run of appointments Thursday through Saturday. Pfizer doses were used, and as you know, sometimes 6 doses available. So you'll see the total number of 13,000 first doses administered. Our practice was to register folks for their second appointment at their first appointment. So really looking forward to doing that coming up here, not this week, but the following week. Next slide, please. Back to our website and call center, it was really important to build this capability for the state in partnership with school districts and local public health to be able to vaccinate Minnesotans. We know there are strong and mighty partners to do vaccine in this state, and we are fully engaged with them, pharmacies, healthcare providers, and others. But we also know that there will be gaps and that we need to reach deep single community, right, to really get the numbers we need to turn this epidemic around. So that's why we can't wait to create the capabilities needed to do that. And that's the purpose of the pilot clinics is to start that process. If we wait until there's, several 100,000 vaccine in the state, that won't put us in a position to deliver the vaccine quickly. So I've walked through the registration process, pre-registration process and the changes that happened yesterday, and noting that we will have expanded opportunities for 65 plus here in the metro area. Next slide, please. And then back to the goals and the benchmarks, right, that the governor sent out. Again, recognize that we have to do this speedily, targeting vulnerable. So you'll see these benchmarks that were set out. Obviously, this is a two-way conversation with providers in terms of flexibility needed, say if there's a larger vaccination event on the weekend. So we have a communication channel on that. But again, the goal is, to get that scarce vaccine out and in use. Next slide, please. And then we have a dashboard, and this dashboard has been dynamic. The goal, again, is to encourage transparency, right, and allow folks to look at the county level. If you hover over, this is a screenshot, obviously, but if you hover over the state of Minnesota, you can actually see by county information, providing you the weekly cadence of doses administered, just to remind folks on Tuesdays, unless, of course, shipping, which is out of our control, varies. But Tuesday or so, doses begin to arrive in the state, shipped direct from the manufacturer. And then so you see sort of that cadence of increased doses based on that, right, along the across the week. So the bar chart you see here, January 17th is the week of January 17th. We received around 60,000 doses that week, and over 105,000 doses were administered. So a great indicator of moving supply through. Next slide, please. And here's more information, right? We are providing more information on second doses, right? Because that's obviously becoming more relevant as we're into week 5 or 6 of having vaccine in the state. So updated the dashboard recently to reflect that breakout. Next slide, please. And we're also providing information on sort of the shipped metrics. I do want to note that 537,000 figure is an all-in figure on first and second doses. Second doses, we actually have a lot of in the state, and they are shipped obviously to be timed for Moderna and Pfizer's window, right, for providing that vaccine. So, and that is obviously an individual healthcare level responsibility. But you'll also see our total provider sites receiving the vaccine. We have over 1,400 registered providers that we communicate with regularly, and there's ongoing recruitment on that front. But you'll note, you can't see it in this screenshot, but not surprisingly, we have hospitals and pharmacies providing the majority of shots right now, and that's reflecting the populations they're serving, right? We have a lot of pharmacies doing skilled nursing facilities and assisted living, and a lot of hospitals vaccinating healthcare workers. Next slide. Great, and here's administration data and a screenshot of just by the various providers that are providing COVID-19 vaccine, how we're doing on, this is a screenshot of our 3-day goal. And you can, again, get this on the web. Next slide, please. And then just noting, and Commissioner, I think I'll turn it over back to you after this slide. Our allocation numbers have at the very beginning were not constant. And now for the past couple of weeks, we've seen around 60,000 a week. I am happy to report a 16% increase for the next 3 weeks. And we received that information yesterday evening from the CDC. So that will result in about 9,000 more doses. A great positive progress. We were told we can expect that again over the next 3 weeks to be constant. But again, it is not enough to serve all the Minnesotans we want to get vaccine to. And then also noting we have additional groups that we are continuing to vaccinate. Chair Housley, and assisted living facilities are in process right now. I believe we have over 400 that have already received first shot opportunity. And many more scheduled this week, right? So back to your point on the most vulnerable Minnesotans and getting to them, our assisted living facilities are next up right after skilled nursing facilities. And that's been a priority to make sure they have a vaccinator partner. It's over 2,000 folks or 2,000 facilities all told, and group homes is another really large universe of people. Next. I can keep going on this actually. So phase 1A, I sort of previewed for you before where we are. Skilled nursing facilities, we're tracking it very, very closely, and I've actually set up a feedback loop with those skilled nursing facilities on progress. We want to know, right? Like, what are the uptakes looking like with residents and staff? It's really important. And I'm sure you know this intuitively, but when administration data shows up in our mix system, it does not say that that person is a healthcare worker or lives in a skilled nursing facility, right? We get a birth date, right? We get that basic information on address. So we've taken the time to make sure that we are tracking progress. And what we've learned is probably what you've heard too, which is residents are actually having a very high uptake rate, and staff is less so. So the question is, not the question, but the work ahead is on the second opportunity for a dose and the third opportunity for a dose in these facilities, right? Like, how can there be education? We all want everyone in that facility to be protected. And I gave you an update on the assisted living facility. I will just remind folks that it was a voluntary choice of those nursing facilities to participate in this federal program with these 3 partners listed here. And so the vast majority did choose to do that program. And the bars you see here are their completion rates of doses, I believe within 3 days. Next slide. And then a little bit more information on long-term care and what we've learned from it. And we're in conversation with the long-term care associations, and frankly would absolutely take this committee's support and feedback in that education on the importance of vaccination. Next slide. All right, and I'll turn it back to the commissioner.
Well, thank you very much, Catherine. So I think, again, Madam Chair, we're feeling good about the progress in phase 1A in terms of the facilities, healthcare workers, and staff and residents in skilled nursing facilities. As Catherine said, I just want to reinforce all skilled nursing facilities have now had an opportunity for first dose delivered or scheduled with the skilled nursing facilities and moving on to assisted living. Expansion to the broader community for the universe of 65 plus is absolutely a priority. And Governor Walz has been advocating hard for more state flexibility to be able to use the doses that are set aside for the federal program, that pharmacy partnership program, to give the states more ability to not just have those doses sitting on the shelf where the state had absolutely nothing to do with how those doses could be used, to now be able to work with the pharmacy chain to assess carefully of the doses that are already in the state, when will they need to be used, and to have more flexibility to use the excess supply, because the federal program, and I think they now agree that there was sort of an over allocation to that restricted federal program, that the estimates of the numbers needed in that program were turned out to be high. So just literally as of yesterday, we have some flexibility to begin to look at the amount that's been set aside for that federal program, to be able to move it further out into the community, into clinics and pharmacies. And that's a really helpful development, because as you point out, Madam Chair, some of the doses that haven't yet been delivered that are here in Minnesota, but had been restricted from our ability to actually get them out more flexibly, that is a significant improvement. So we will, and I know you've got more questions on the pilot sites, but just to reinforce something Catherine said, those pilot sites are not intended to be the main delivery vehicle for how people 65 and older will get their vaccines. Their clinics and community pharmacies will absolutely be the backbone of where most of us get our vaccine as that supply ramps up. So let's stop there, and we'll go to your questions, Madam Chair.
Thank you so much, Commissioner Malcolm and Ms. Blaufeld, for the slides. I keep hearing through the departments and the governor's press conferences and presentations that the vaccine rollout needs to be orderly and equitable. And every time I hear those words, I just kind of cringe, because I haven't really seen anything orderly about it. I see mass chaos when it comes to this whole rollout, and the website crashing and the phone calling, and seniors, waking up at 4:30 in the morning to make sure they can get to that website. And then back in the beginning with it crashing, and then switching the system to the lottery. And I could just go on and on, but I won't. But the orderly and equitable, is it the mission of the governor to sprinkle the vaccines across all different sectors of Minnesota to be equitable, or is it to prioritize seniors? Because I think if you're a senior, or any of us here on the outside, when you're seeing only 8% of our seniors 65 and older, again, those most at risk of dying, not getting the vaccine, and then holding big events to educate younger and healthier workers. So is it orderly and equitable, or is it prioritizing seniors? Commissioner Malcolm.
Thank you, Madam Chair. I think certainly we would acknowledge that there are a lot of groups that strongly feel like it's urgent for them to get vaccinated. Essential workers, teachers, but the governor has clearly said 65 plus, and the federal government said this as well, and we agree with it, that for all the reasons you stated, the 65 plus population has to be in that first tier. Does that mean it's only 65 plus? I think, we could have a reasonable debate about that. I think the governor has prioritized after we have to finish healthcare workers. There are a lot of very vulnerable populations being served by the remaining healthcare workers, home care, personal care attendants, the remaining folks in the community who are care providers. We know we have to finish that job, and we need to, and we've expanded to 65 and over. That remains all of our guidance to providers and pharmacies is that's the priority population. The education, the pilot sites were set up to try to get going on getting teachers vaccinated and childcare workers who are so essential to kind of keeping so many sectors able to be functioning. So these pilot sites were really set up to try to develop a proof of concept, if you will, of how would you do that? How would you create some community-based events for focused populations? But the 65 plus population is absolutely, the directive for everybody who's vaccinating is that is the priority population. You mentioned, I would just point out, it was 1 week between the first pilot sites and yesterday when the entire system was rebuilt to avoid some of the chaos that you point out. And I really want to thank all the people who worked so hard to try to make it a vastly better experience yesterday than it was the first week. We now have a waiting list of folks that is going to be a very valuable tool for us to help connect those people who are now all on the waiting list with sources of vaccination. So I think building that information system for people to have a place to say, I want to be vaccinated, I want to get in line, I want somebody to help me get connected to vaccine, that's going to be a really valuable tool. I think what I would say, the share of the population or the share of the vaccines that are going to 65 plus, you should see that improve quite dramatically as we finish the healthcare workers. And those doses are available to make faster progress in the over 65 population. So, excuse me. I think, you're right. The vaccine's been here a month, and it's been here a month. I mean, this is a complicated operation, as I know you appreciate. But the providers, the clinics, the pharmacies, local public health, everybody's ready to do more when more becomes available. So I can just say you're right to hold us accountable and to ask us what the priorities are. I think we will demonstrate that with the numbers you will see.
Thank you, Commissioner, and I'll open it up for questions. But just one thing to that point with the, now you have a list. I want to thank you for taking my recommendation a while ago when I told you the seniors that have been calling me and emailing saying, can we just please go get our name on a list somewhere? Just, we don't have to know a date. Just let me know that I'm registered somewhere. But to that point, you have a huge waiting list of these seniors wanting to get it. And they're going to see on the news tonight, all these young, healthy workers down there at Roy Wilkins XL Energy Center getting the shot in their arms. So that I don't see as being prioritizing our seniors. If you want to respond, you can. Otherwise, I'm going to go to Senator Rude.
Oh, I think, Madam Chair, I think I'm sure a dialogue we'll continue to have is, can you do more than one thing at a time? Can you make progress on two important priorities? But it's not the case that the doors are flung wide open and there is no prioritization. We're working hard to prioritize.
Just quickly to that point before I forget, because I know there's so many and I'm sorry, you guys. But is it true? I saw an article 2 days ago where those vaccines that were sitting on the shelf, have they been taken from going to long-term care facilities? 30,000 of them in Minnesota. It says a state spokesperson said 30,000 vaccines coming from that vault of vaccines that you have stored up and not going into seniors' arms, but pulled aside for teachers and child care providers?
Madam Chair, I think, the specific, like which doses are going where is not something I can answer with great precision. I just want to be really clear that the doses, the federal Pharmacy Provider Program, PPP, everyone now agrees that was over allocated. There were more doses set aside and locked up for that program than was needed for that population. So some of those doses were freed up for broader use, 65 and over, and childcare and early education. Which if you we just kind of put it all in the pot of the weekly allocation and then allocate that directly out to healthcare providers all over the state, and to federally qualified health centers, local public health, and then we've had these pilot sites. So that we kind of weekly go through this allocation to the different distribution channels, if you will. But clearly with the priority population of 65 and older, and finishing up healthcare workers, and the education pilots have really been, very, very, very focused around that goal. And we can just, I guess, continue to dialogue about it. The importance of getting teachers back in the classroom.
Thank you, Commissioner. Again, I think what I'm hearing is that the vaccines are being diluted that I feel should be going to our seniors, and they're going to all of these different sectors. But I'm going to go to Senator Carrie Root, and then Senator Hoffman will be after Senator Root. Senator Root.
Well, good morning. And I think it won't be a surprise that I'm going to mention the map, the pilot map. That again, the greater Minnesota has been ignored again. And it seems like it doesn't matter what the issue is. There's this big hole in the middle of the state that never gets addressed. And I only mention that because Aiken County has the highest median age of any county in the state of Minnesota. And yet none of those needs, the pilots are everywhere else but where the senior citizens are. And with that, I just wonder if the governor ever steps back and looks at the chaos and looks at it from the view of a senior citizen, which I am, and I admit it, and step back and look at it, how a senior citizen looks at this. It's absolute chaos for them. And you ask them to sign up on a website that crashes. They have family members, 4 and 5 friends, family members trying to call, trying to get in, desperate to get the vaccine. And then we go to a lottery system. And if you step back and look at the fact that we have a lottery system for seniors to get the vaccine, how really ridiculous that looks. I can't even imagine being a senior and trying to get and know that you are so unimportant that we're going to do a lottery for you. And so I just ask you to sometimes step back out of your role and have the governor step back and take a look at how the seniors look at this, because it's utter chaos to them. And they are at a time in their life where there's so many things changing for them every single day. And they have to, and now this chaos around whether I'm gonna have a lottery to live or die is, I can't tell you how upsetting it is to them. And the emails and the phone calls that I get, and I shared with Senator Housley, the lady this morning, the 96-year-old lady who is being cared for by her 72-year-old daughter, and they tried to get into a lottery system to get the vaccine. And there's no prioritization of that scenario that I can see. So I just felt I needed to comment on that. So thank you.
Madam Chair, may I respond?
Yes, Commissioner Malcolm.
Madam Chair and Senator Rood, thank you. Your passion for your constituents, of course, is very clear. And again, I just want to reiterate, the pilot sites were just that. That is not the main way that seniors are going to get vaccinated. We can never do enough communicating. We have to communicate more. We have to communicate more clearly. We would appreciate your help in the committee, the legislature, community leaders, helping to educate. It is a very confusing situation all over the country, kind of no matter the approach that is being taken. The shortage of supply and the high demand is creating a lot of what you say, Senator Rood. But those 9 sites are not permanent sites, and they are not the main way that people are going to get vaccinated. So I think they were set up quickly, as Ms. Blauvelt said, as to learn kind of the mechanics to get the playbook ready for how to do that. We expect that the federal government is going to be asking us to stand up community-based sites. So knowing how to do it, we felt it was prudent to learn to develop those systems now rather than in 2 weeks or a month when the feds are giving us the opportunity to do larger sites. So again, I think the main way that most of us will get our vaccine is going to be through those established community channels, our clinics and our community pharmacies. So we are working with them now to be ready to quickly administer what relatively few doses we have so that all those doses get used in the week they arrive in the state, and developing the systems so that that everybody is ready to vaccinate at larger numbers as our supply ramps up.
Thank you, Commissioner.
And Madam Chair, to that point, I think it's very important that we utilize. My district has phenomenal healthcare. We have great systems in place, and they're not being used. And my constituents tell me that they have gone to the clinics and the hospitals, and they have the vaccines, and they cannot get it. And so I think we have really underutilized the great healthcare systems that we have. And I hope going forward, we do more of that and allow the healthcare professionals to be in charge of this instead of the state.
Madam Chair.
Thank you. Thank you, Senator Rood. We will go Senator Hoffman and then Senator Curran. Senator Hoffman.
Thank you, Madam Chair, and thank you for bringing up those statistics that you did in the opening statement in our committee. And it just dawned on me that we have more people. I mean, we talked about it for years, but now we have more people 65 and older than we do in the K-12 system, right? And then to see your graphs that show where the need is really hinders our ability to really do what's right? I mean, it's pretty amazing to me. And Commissioner, thank you for clarifying our last conversation on the non-emergency medical transportation providers. That was really helpful to get that information out. There are a lot that I know that do that, and so thank you to doing that. I also sent Lisa a follow-up specifically on this age range, right? The 65 and older. But a couple of things. You mentioned leading age, and leading age nationally has said that, this whole reallocation thing that's going on, that again, Madam Chair, thank you for bringing that up, is how do you respond? Because there's an optics problem there, right? No matter what we're saying within our bubble, there's still the greater majority of people are going, help me understand this. This absolutely makes zero sense to me. If indeed Minnesota has reallocated 30,000 of its shots, which according to the political and other folks within leading age that this has happened, leading age says that the reallocation means that our seniors are not getting prioritized. And further, they also said that during this whole pandemic, they don't feel, as a national organization, that the seniors in that range have been a priority. And so when you see something like that, or when you hear about how hard it is to get online, it reiterates that branding or that marketing or that whole optics problem that it's there. Now, I understand there was 2.7 million doses that were allocated through the CDC to long-term care facilities, yet when we look at those numbers, only 25% of those actually have been dosed out, right? I think that's the word you use. And I'm not a doctor. I never played one. Dr. Abler, is that the word you use, dosed out? Is that, forget it. I won't. But I think this is really important for us to have this conversation today, because there's a lot of misunderstanding out in the community. And when you look at that article that says what they said, and when Chair Housley brought that up, I really think it's something that we need to take a self-reflection and look at it and say, are we doing all the things that we can do? So again, thank you for the clarification. I think you're going to need to also do the same thing regarding this statement with leading age and with the article that we read that shows those 30,000 doses. So, that's I guess it's more of a question and a statement at the same time. So thank you.
Commissioner Malcolm.
Thank you, Madam Chair. Senator Hoffman. Yeah, I think we are, as you've seen, trying to get more and more granular with the data that we are posting about where the doses are and where they're being given and by whom and to whom. So we understand your need for clarity and specificity and for Minnesotans, and we just really are very eager for your partnership and your help with some of this education, the reality of the limited supply, what we're trying to do to allocate it appropriately and equitably from a geographic perspective and from a population perspective, and being precise about what is going on with that federal pharmacy partnership program, and to the extent that we have asked for and gotten more ability to not have those doses kind of locked away. How are we using that to increase community accessibility for the 65 plus is the right question, and what we will be able to show you in these next couple of weeks.
Thank you.
Madam Chair.
Senator Curran and
Madam
then
Chair.
and Ms. Blaufeld, I think we need to mute you.
Oh, I'm sorry.
It's okay. Senator Curran.
Thank you, Madam Chair. And so I'd like to talk about the stated goals versus actual. And it's the same thing over and over that we keep hearing, is that we've made this 65 and over eligible, but our actions haven't shown to prove and to direct the vaccines to those truly eligible. If 90% of the deaths are in the, since we've known that from the very beginning, again, that's the most troubling piece. 9 months ago, we knew it was 90% of the deaths were in the seniors facilities or those over 65. So we talk about adding those as being eligible. Then at the same time, part of the earlier conversation, we're now adding teachers to it. And we're going to do a vast pool, and the optics are going to be horrible. Everybody, all young people who are minimally impacted are going to be in line. So if you look at recently, I think CDC just came out and schools can safely reopen. They haven't shown to be the vectors of transmission. I think one of the statements, one of them was, there's been little evidence the schools have contributed to meaningful increase to community transmission. They can do it with distancing and masking. And so when we look at, again, 90% of the deaths, I understand not 90% of the vaccinations can't go to the elderly because they're just not available. Because we actually have critical care providers, and that's the care providers, the hospitals and the nursing homes and the actual ones providing care. But we've confused terms, I think, in this entire pandemic. We've confused critical need and critical care employees versus essential. Every job is essential. Every job is not essential in the relationship of curing a pandemic or combating the pandemic. So I would like to see, and everybody here would like to see, if it's 90%, and we're really focused on critical care providers that we have to for our entire healthcare system to keep it up and functional and save people. If the goal is not to save 90% of the people, then something's really missing here. And so the rhetoric I get tired of hearing is that the highlight is we're going to really we're compassionate about seniors, we're going to add them to it. But the actions just don't reflect it. And the governor's redirection of these vaccines to somebody other than the senior citizens and critical care providers. So to me, that's just unacceptable from the very beginning. And so we're trying to please everybody and through political correctness versus actually trying to solve the greatest need in the greatest population that we have today. And so with that, Madam Chair and Commissioner Malcolm, in the school, I see the schools being very critical, but only if we intended for them to be open. The governor said at the same time, 65 and over are important, but we're not going to open the schools, probably until summer sometime. Now, I have schools open in my district. They're open. They're ready. They're doing it safely. They're doing it distance, and they weren't vaccinated, the vast majority of them. So as I see it, of the schools, of the public school systems, the vast majority are closed, minimally open, if at all. So with those teacher allocated vaccines that are going to be done at the auditorium this weekend, are they going to go to the private schools that are actually open, or is it public school allocation? I'd actually like to know if there's a difference. But either way, we have to get, if the goal is not 55% or 60% of the vaccines to senior citizens. I would like to know from your office, who are the true critical care providers and what portion of the allocation are we going to need for them? Other than that, I don't see another higher priority group to be served except for the population over 65, where 90% of the deaths are occurring. So I know that's a lot, and I know, but to me, that's what we need to see, because our people are looking and saying, if it's 90%, there is no other top priority besides critical care providers, and those and again, that's in hospitals and or nursing homes or any of the convalescent facilities. So I would like to see, what is that stated goal? If Senator Housley said it's 23% of the vaccines are going there, in 2 weeks, is that going to be 55, 60%, or what is that? Because that's what I think we need to do, and not confuse politically correct pandering. We're going to go after this population, that population. They're not critical from the perspective of the statistics on the risk to being vaccinated or unvaccinated as it relates to their safety. And so we would like to see that being forecast, because you guys are exclusively in control of the doses you have. And we know you don't have all doses, but of the ones we have, they absolutely have to go to the critical. Let's not get confused with the essential, critical, and our elderly. So I'd like to know how over the next few weeks that we're going to achieve that goal.
Thank you, Senator Curran. We only have 7 minutes left with Commissioner Malcolm, and we've got 3 more senators that have questions, and then we will stay after the commissioner has to leave to go over some of our other questions, and maybe somebody can answer them for us. But Commissioner Malcolm, to Senator Curran's questions/comments.
Thanks, Madam Chair and Senator Curran. I think we are getting very close to the end of the 1A phase, and we'll get you data about what critical healthcare workers remain to be vaccinated, and what of the population in skilled nursing and assisted living remain to be vaccinated. We believe that we are on a pace to finish those critical first critical waves, at least with the first dose being delivered, or at least scheduled, very close to the end of January. So we really have made great progress in healthcare workers and in the populations living in congregate care, elders. And as you keep pointing out, and we couldn't agree more, the priority extends beyond those in congregate care facilities. That's been the most acute risk for our seniors. The data are clear about that. But for 65 and older living in the community, that's absolutely the next priority. And we can absolutely continue to show where are those vaccines going that are going to vaccinate those 65 and older. It's not just to the pilot sites. It is to hospitals, clinics, and pharmacies all over the state to be able to vaccinate the over 65. And that's the guidance to them. It is not to vaccinate anyone and everyone. It is to prioritize the 65 plus population. We will continue to work on education pilots, because it isn't just the kids, obviously, who are at low risk. It's the teachers, many of whom are in those higher risk categories. Schools to be open, which is the goal. What the governor said was we want to do more to support schools to be able to be open. And that does include, making sure that there's adequate testing and vaccination for the staff who have to be there to care for the kids. So we do believe that is a priority, but we are totally happy to continue to report progress at a very specific level about essential healthcare workers and the over 65 population.
Thank you, Commissioner. We will go to Senator Eakin, then Abler, then Putnam. Senator Eakin.
Thank you, Madam Chair, and thank you, Commissioner, for being here today and work. I think you take a lot of heat. I don't envy your position. You're taking a lot of heat, I think, in part because of the something you have no control over, which is the amount of vaccine doses that are coming to the state of Minnesota, which is creating this bottleneck here and getting the vaccines out to the people that need it. But I would like to add my voice, I guess, to those who are saying maybe we should be reevaluating, given the limited amount of doses that we have, who is really being the focus here. I know that those 65 and older are the focus, but maybe for those who aren't in that critical age group, like child care providers and like those in the education community, those in the older age groups can't afford to wait, and others can. So I would agree with those that are saying that at this point, those 65 and older should be the focus until we get enough vaccines to start covering others, and hopefully that comes soon. I did have a question in regard to the pilot programs. The pilot sites. This is a very large state, and a lot of the higher percentage of the elderly do live in these smaller rural communities. They have a higher percentage of seniors. Just wondering how, I guess, the decisions were made as far as where the pilot sites would be located and how many there would be, and whether there's any plan to expand them. I know you said that they're not permanent, but if there was any plan to expand the number of sites to make sure that it's more easily accessible to those who need it, especially in the more remote parts of our state. And then one last question dealing with the workers in our long-term care settings and the congregate settings. I was a little concerned to hear that there were a number of them not taking the vaccines because of concern. I assume that it's because of concerns about the consequences or what the side effects might be. And I'm concerned about that because we need to have a significant portion of the population taking the vaccines in order to develop that herd immunity that's so critical here. And if that's still an issue, if it's being worked on as far as education, trying to promote the vaccines, trying to educate people about the benefits and allaying people's fears about the consequences of taking them.
Commissioner Malcolm. Thank you, Senator Eakin. Commissioner Malcolm.
Yes, thank you, Madam Chair and Senator Eakin. Very much appreciate that. Let me respond to the question on workers in long-term care first. It is a concern, and I think as Ms. Blauvelt indicated, we're really hopeful, and what we're hearing from the long-term care facilities is that it's more a question of wanting more information, wanting to sort of see how it goes for to get vaccinated. They're not saying they never would get vaccinated, but they don't want to be first in line in this respect. But that we already see that changing as the second clinics are offered. And workers have seen their colleagues get the shot, feel good about it, and we fully expect to see that uptake continue. But it is very important. I mean, to protect them and to protect the people that they care for. So we will continue to work hard on that with the folks on the ground in long-term care. In terms of the pilot sites, again, I would just say that we're just beginning the second week of operation. Then we will really assess what did we learn, what should we do differently. So I can't forecast for you today what will be sort of the future strategy with these community-based sites. We think they have a role, as we found out with testing, that kind of a really easy additional outlet for people to try to get vaccinated in addition to their clinics and pharmacies. It seems to be a good concept, but we want to evaluate where that fits in the whole scheme of things and where those things could be best located to fill in gaps, because it should be about filling gaps and creating barrier-free opportunities. It's not in any way intended to displace the role of providers and pharmacies. So more to come on that. How do we make sure we've got geographic coverage? As Senator Ruud mentioned earlier, we're blessed with really pretty good geographic coverage of healthcare providers and community pharmacies in Minnesota, and that's who we need to use to really get these vaccines everywhere.
Thank you, Commissioner. Can you stay for two more Senator questions?
Yes.
Okay, thank you. Senator Abler, then Putnam. Senator Abler.
Well, and thanks, Commissioner. Nice to see you again. And you look tired, and I can't imagine the 10 months you've had. And your governor is tired, and frankly, he gets crankier than you do. So I appreciate your patience with us. And And I say that actually consciously, those two terms, because it's and sometimes these hearings come off as being critical, and I'm sure I could fit into that category sometimes. But as I look at my screen here, we're in little boxes, and we can't get out of our box in trying to help the governor and you lead this thing. And the power is in your box and in his box when he's appearing, and we talk and we give advice. And I've, in my 3 conversations with the governor since March, July, September, November, I've urged him to share the load and listen and help us to engage in ways. And I don't fault you, Commissioner. You're just working so hard, but it's like nothing changes. And we have these hearings, and you're so kind and professional. But at the end, Mr. Hoff and the others just continue on with decisions that they make about the seniors, and Senator Housley's point, which I think is very valid. And we had a hearing, Senator Benson's committee, about the pharmacists are eager and willing and ready to do this, and they're everywhere, and nothing changes. And the schools, we're moving to more decentralized things with schools, and the governor cancels playoffs, and like what, wearing a mask outside, and the hockey, and Commissioner, we are just frustrated, and we're on the same side here. Each person in these little boxes and all the staff that are here in their box cares a lot. And if we're ever going to get through this thing, somehow the governor has to decide he needs to share it with us, with people who care, people in touch, not competitively, just in a way to make it work. And the good news is I think the seniors are safer. The restaurants opened and deaths have gone down. So I don't know what to tell you, but I'm trying to be encouraging. I talked to some mental health people. They say you sound cynical. I'm not going to be the cynical guy. None of us want to be there. We just don't know how to be part of the process. And all this, I guess it's a comment, but there's no lack of good intent, but the door needs to open a little bit, and something needs to change after a hearing like this, or after hearing like Senator Benson's, or the one before, and instead of just whoever they're listening to deciding, oh, that was nice, and how was the hearing? And people will say, well, it was fine, you didn't take on too much water. And the reason I've commended you for being there is because I know your wisdom and your experience and your sagacity. Is that a word? Anyway, so I'll just stop there, and thank you, Commissioner.
Thank you, Senator Abler. And just one word of advice: you never, ever, ever tell a woman she looks tired. We work hard. You look fabulous, Commissioner Malcolm. I'll toss it to you. You look well rested. You just work hard.
Thank you, Madam Chair. Advice taken.
Commissioner Malcolm.
Thank you for the kindness. I appreciate it. I certainly will pass along that feedback as I know you have. Thank you.
Thank you. Senator Putnam.
Thank you, Madam Chair, and thank you, Commissioner Malcolm, for being here. I just sort of want to second both the sentiment and the style and some of the vocabulary of Senator Abler. Obviously not the last bit for which he was admonished by Chair Housley. I think in moments like this, every single one of us has in some way been traumatically impacted by COVID. That needs to be the starting point. I mean, I lost my grandmother 2 weeks ago from COVID. We're all feeling something deeply. And in moments like this, it is both reasonable and right to demand accountability. But I think when I think of accountability, and perhaps this is because I'm new to these discussions and to state government, accountability must always be precise and articulated to responsibilities. Who is supposed to do what? So, Commissioner Malcolm, you alluded a little bit to the federal pharmacy vaccination program. Could you talk a little bit about relationships between federal and state programs and whether or not they're playing well, and more importantly, the state's responsibility, and if you think relationships between the federal government and the state government might get a little bit better in solving the problem that we all identify and that is all motivating our conversation today?
Thank you, Senator Putnam. Commissioner Malcolm.
Madam Chair, Senator Putnam, thanks. I think that it is essential that the federal, state, and local levels of government are working together and are on the same page, and have a common strategy and clarity of responsibility and goals and accountability. And that has been challenging. And we do hope that improves. And early signs are good. We've been promised more visibility into what the reality of the vaccine supply chain is and what we can expect. We've just, as of last night, as Ms. Blavat said, for the first time, we've got some guarantees from CDC about what we can expect for the next 3 weeks. That will be helpful in making some smarter decisions about how to allocate and what our partners, clinics and pharmacies in particular, can count on to plan out a little bit further about how to ramp up capacity. The federal partnership program, there was a direct contract between the federal government and these big chains. They required us to set aside and put in a lockbox a whole bunch of vaccine for that program, regardless of how quickly it was being used. And that too was a thing that just changed yesterday, was the ability for states to be able to use some of what is sitting there ready to be used to get it out more quickly. Now we're still responsible when those pharmacy chains need more to finish the job in skilled nursing facilities and assisted living. We have to make that available. We've now got the flexibility to be able to not have it, sitting on the shelf for weeks at a time, when we could put it to faster use in the community. So that's just an example of what is changing, and I think it's a significant change. So I think it's a good sign.
Thank you, Commissioner and Senator Putnam. I know you have to run. I don't know if anyone else will still be here to answer our questions. Otherwise, we'll just throw them out there in the committee and hopefully somebody can watch later.
Yeah, thank you, Madam Chair. And my apologies. I literally have to go do this work right now. But I do believe our legislative director is still on the line, along with a couple of our other MDH staff. So if they can't answer, they will get the questions to us, and we will. I appreciate your time this morning. Your commitment, your desire to work as partners is very clear, and I thank you for that.
Thank you so much. I hope the message gets to the governor that we are here ready and willing to work with him. And the message here, I think, has been, let's make sure that our seniors 65 and older are at the top of the priority list. So thank you. Have a good day. And thank you so much for your work. You look fabulous.
Thank you, everyone. Bye-bye.
Right. See you. Senator Hoffman, you have a question.
I do, Madam Chair. I think, bye, Commissioner. Thank you. This dialogue, it seems to cut across the whole conversation. And is there anything our committee can do to take action? When we talk about who's responsible, it's not about pointing fingers, but it's really Senator Abler's point about we're here to work collaboratively. Senator Putnam's point on that, even, Senator Curran. I agree with Mark Curran on a couple of points there. How's that one for you? But seriously, I think, is there something that we can do to add teeth, whether it be a letter, or whether it be an action, whether it be something that all of us, and this is what you've done well in this committee in the 5 years now that I've been on it, we set the political stuff outside and really focus on what our intention here, and it's our aging community. And I'm unsettled right now because of the stuff that you showed us, right? And then the conversation about, well, what if they're doing this? Why is it that a person in the VA can get a shot, but his wife can't get it because she's not a priority? What the heck? I don't get that one. So I guess the question is, what is it, folks, that we can do as a collaborative committee to get our word out publicly and to the governor?
Thank you, Senator Hoffman. I think continuing to have these committees and bringing the commissioner back and the department to hold them accountable, like Senator Putnam said. I do think a letter probably is a good idea, and again, to engage us. This is the purpose behind this committee, is our taking care and protecting our and being the voice for our seniors in Minnesota. And somehow that message isn't getting to the governor because only 8% of the voices are being heard. So I think that would be a great idea if everybody from the aging committee would want to sign on to a letter, and please, Governor, listen to us. We've heard from Minnesotans, and we want to make sure that those 65 and older are a priority, top of the list, and not dilute these vaccinations that are coming into the state. And Senator Putnam, to your point, and maybe somebody from the department can answer, when the CDC had the guidelines for what to do with these vaccines, I know some states opted out and went and did their own thing and have actually been more successful. Was that ever considered by the department to just go, we have actually a better plan and we're not going to do what the whole, most of the country did, but was that ever in discussion? And I don't know who, maybe just unmute yourself and chime in if you have the answer.
Madam Chair, this is Lisa Timian. For the record, I'm Legislative Director at the Department of Health. I think first it was very clear guidance from the CDC and the ACIP to follow the 1A guidance. And so that was what we were committed to. As you may know, Minnesota is one of the, we have a renowned vaccination program run through the Department of Health, and really trying to work on focusing those first outlined priority populations. And now as we continue on working with that, but also expanding that to the 65 plus and educators as well. So kind of walking and chewing gum at the same time to get as many vaccines into arms as quickly as possible throughout the state.
Thank you. Again, I don't know if the message is getting through. Above all else, I mean, we have the healthcare workers pretty much all vaccinated. Those who wanted to get it, got it. Next in line is 65 plus. And I still keep hearing there's more people coming into the competition, into the lottery for these vaccinations. And I mean, we've heard reports, I actually know somebody who was a non-patient, non-facing healthcare worker getting shots. IT workers in these big healthcare settings are getting them. And the seniors hear this. My friend's grandson got the vaccine while she continues to struggle with the website and trying to get in. And her whole family is trying to, and I can actually say, and I don't know if there's safeguards against this, I do know of somebody who has gone in and applied to the website 10 times to have more chances to get the vaccine. And they've been able to go in 10 different times using 10 different email addresses and 10 different phone numbers. So I don't know how much more that's clogging it up. Like the list that you have, are they all, one single person, or do you have one person in there 10 times? So I just want to make sure that what this committee is saying, and each one of us has said it, prioritize, top of the list. Above all else, I can actually tell you teachers would say, yeah, okay, I get it. My grandmother deserves to get the shot ahead of me. I'm okay with waiting, especially if we're not going to open up the schools. So I don't know if you want to comment on that or if I can just continue with the questions.
Yeah, so Madam Chair, I just wanted to flag, so as of January 14th, we were encouraging healthcare systems and the 1A folks who had the vaccine to be, again, reaching out to their established patients who are 65 plus, similarly working with our federally qualified health centers to make sure that they're also working with their patients. Because like we said, we're not intending the vaccination pilot sites to be the only places where folks can get vaccinated. That's not intended to be the main piece of that. We're really hoping that folks can go through the regular doctors, pharmacists, what have you, especially as we get more vaccine available. And then this week on Monday, we also clarified that we are expecting that vaccines are administered with 90% within 72 hours of receipt and 100% within 7 days. So again, trying to get providers as well to be reaching out to their patients to get those appointments scheduled, in addition to what the work is happening at the vaccination sites. Thank you.
Thank you. So I guess I'm hearing two different things also in that January 14th, MDH guidance allowed the healthcare systems to get in line for the vaccines or start getting vaccines. But then on the other hand, Commissioner Malcolm said this rollout has only been going on for the last 2 weeks. So I think what's frustrating, and I don't want to be attacking, but again, being a senior, like Senator Rood said, and just in plain speak and what they're seeing, they are seeing everybody getting in line ahead of them. And where was the planning? It's been almost 11 months since our first lockdown. This isn't new. We knew the vaccine was coming sometime. We had inklings of it in November it would be coming, and it got here December 23rd, and it's still not orderly and equitable for seniors over 65. It's been complete chaos. So was there any planning back, September, October, November, and going forward, what is the plan? Because again, you're living in a long-term care facility. You want to get back to normal. You haven't been able to have congregate meals with your friends or play bridge. They want to know where is the real light at the end of this tunnel, and when can facilities reopen again, and when they do reopen, do the healthcare workers or the caregivers still have to get tested? So is there planning going further, or is this always going to be a fly by the seat of your pants knee-jerk reaction, which is what I feel this whole thing has been? And I'm sorry again, it's just that when you and I'm sure you are too, Ms. Timian, but the emails and the phone calls, and it's just heartbreaking to see the 96-year-old in Senator Rood's district with multiple underlying conditions not being able to get in the queue to get the vaccine. And she's going to see her 40-year-old teacher of her great-grandson get the vaccine ahead of her. So I don't know how you want to respond to that. I know you guys have a tough job there, but I want to make sure that there's a plan in place, and people need to know the plan. The seniors do, the caregivers, the family members. Where is the plan? I think there's been a poor lack of planning up to this point.
So absolutely, Senator, Madam Chair, members of the committee, I'm happy to respond to that. So, we had done many months of planning, and at first, up and through the beginning of December, when the ACIP came out with their first 1A, we had just been planning on healthcare workers. And then based on the suggestions in Minnesota and other states, they added the long-term care facilities and residents. So then it was like, okay, how do we, rapidly scale up to capture that universe as quickly and efficiently as possible, in conjunction with the work that the federal pharmacy partnership program was going to be doing at the same time. Then we were, the 1B recommendations came out, I believe, December 21st. So we started planning for that, which was at first essential workers and folks 75 and plus. Then about 2 weeks ago now, I think it was, the previous administration announced that there was more vaccine that had been held back, in that they were going to be sending a vastly increased supply to states, and that we should open up to 65 plus. We agreed with that. So we started making plans really on the fly. How do we rapidly get now this plan into how can we quickly adjust to getting 65 plus folks vaccinated as quickly as possible, as well as getting vaccine through their providers, their normal routes, plus the other essential workers. And how do we start managing this? Then we find out there was not, in fact, extra supply coming from the feds at that point. So then these plans we had in place, we decided we'd still go forward as a pilot project to start understanding what would it look like once we finally have supply that can match the demand. So that's kind of where we are now. So it's not that there hasn't been a lot of planning, but I would also say there have also been a few loops that we've tried to rapidly adjust to.
Thank you. Thank you for that answer. And I'm sure it is hectic when you don't know how many vaccines you're going to get and how do you set it up. And I totally understand that. But I think going forward, we have to get a plan in place like now and see it in red. And maybe Senator Hoffman, to your point, in that letter, let's put our recommendations together point by point. I know we did that with the testing, and we recommended that they bring in the National Guard for the testing. It took a couple weeks, but they finally did it. So why don't we put together a letter like that, which is going to say at the top, 65 plus, and then everybody else. I have another question, and this is when you do go to that website to set up, to get in the queue for the lottery, there's all sorts of questions that they ask, and all sorts of data that the Department of Health is collecting. And if you don't answer those questions, it says you won't be able to be pre-registered. So if you don't answer what race you are, or where you live, or if you're Indigenous, what tribe you belong to, you don't get pre-registered. And my question is, one, what do you do with that data? Two, why do you need that data? And why aren't the questions, you know, how old are you? Do you have any underlying conditions, and what are your underlying conditions? Because I don't think we should be prioritizing on race or whether or not you're a homeowner or a renter. It should be prioritized on how old are you and what are your underlying conditions. So what's done with that data, and why do you need to collect it? And then Senator Coran.
Madam Chair, I do not know the answers to that, so let me get back to you on that piece.
Thank you. Yeah,
Madam Chair,
yes, Senator
to
Coran.
that point is the very same question I have is, has the scripting been provided to you as the chair of the committee to understand what information is actually being requested through that senior citizen or the over 65 special lotto website? It looks like a whole host of arbitrary and unnecessary information to determine if you should participate in the lottery or eligibility in the lottery. It should be very clear, as you described. Are you over 65, and do you have pre-existing health conditions? And the likelihood is the statistics don't even qualify as far as, you know, if you had a pre-existing. It's clear over 65 contributes to 90% of the deaths. And so I've gone through the script. I'd like to see the full detail of all the how it's used, and I want them to publicly say what is the criteria utilized, the exact criteria that makes you eligibility for the randomness of this lottery. And so the other criteria could be information only, but from the need of getting you on a waiting list and selecting you, it should be very clear. And it should not contain, or it's unnecessary to contain all of the other information. It just excludes, or it seems that it would divert the priority of serving or offering this vaccine to everybody over 65 who is over 65, which determines your eligibility. So I believe we should request that from the committee, from the Department of Health. Thank you.
Senator Cran, thank you. That is a great point, and I think we will add that to Senator Hoffman's letter, that our recommendations and then our questions, because I still have some more questions. I've got like a whole sheet of questions here that I want to ask, and one of them, and maybe somebody from the department can answer. How was this company, this vendor who was hired by the state, like who are they? How long have they been in business? After their first attempt a week ago, their site crashed. And now this whole lottery system that the website's only open for 24 hours. And then again, all of these questions that they've been asked. Was there a request for proposal process or any other applicants, or did anybody come to the state? Or why was this random new company picked to do this huge job when other states are doing it? Ticketmaster and Eventbrite, companies that have handled Super Bowls and hundreds of thousands of people, and it's running smoothly. And then yet here in the state of Minnesota, we have a young startup company doing the website that crashes or is only open for 24 hours, and taking all of these people's information. What was the process in hiring this company?
Madam Chair, members of the committee, I do not know the answer, but we will be happy to get back to you. And I did, one of my colleagues did the phone a friend, and they did inform me that there is a prefer not to answer under the race and some of the other questions. But you do have to put in your birthday, which would tell if you're over 65, since that's the population being focused on for these pilot sites. And we can follow up with more of the questions and what that looks like. Thank you.
Thank you so much, Ms. Timian. And Senator Cran, to your point, no, I didn't get the criteria or these questions that were asked ahead of time. One of those people that I know who has entered the lottery 10 times screenshotted the questions. I found that out last night. I was like, what? Why do they need this information? All right, so are there any other questions, members? I think that that will do it. Senator Hoffman, I'm definitely going to get that letter together, and I can get it to each one of you, and you can take a look at it to see if it's something you'd be willing to sign on to. I want to thank you guys. You're correct. This is my favorite committee. I think we have the most important job in the state in protecting our seniors and being the voice for our seniors. And you do too. The message here really has been sent, I think, loud and clear. Governor Walz, we want you to work with us. We want you to hear us, and we want you to hear the seniors of Minnesota, because those are the ones that are most at risk of dying from this virus, and they should be the #1 priority in getting this vaccine in wherever they're living, assisted living, long-term care facilities, or in their own homes. That Senator Hoffman, I'm doing my wrap up, and you got to raise your hand.
I'm sorry. I just want
no, Madam Chair.
No,
Tell them
you're
we're
doing a
done
great
now.
job, wrap up. But the process, do you want like Eric and Mark and Ethan to send you the stuff that they had talked about, or did Susie capture? That was it. My ADD kicked in, and I had to ask that question just so it was a follow up. But I did not mean to cut you off from your wrap up. You're doing a fantastic job. I'll be quiet.
Madam Chair, he meant it. He meant it, Madam Chair.
It's me, thank you. It's me and my ADD. I saw the little hand go up and I was like, whoo, shiny light. Yes, why the process, I think if each of you can send me your questions and your concerns that you did say today, and I'm sure some more will come to you, and I know there's thousands of people watching this committee right now that may be sending you their questions too that didn't get answered today. But again, being the voice, our committee for the seniors here in Minnesota, it is our #1 priority that those 65 and older, those that want the vaccine, should be #1, top of the list, and make this easy and convenient for them. Clinics and hospitals and their pharmacies locally is where they should be able to get that. So hopefully Governor Walz, Commissioner Malcolm, Department of Health, you heard us today. We'll continue to, as Senator Putnam says, hold you accountable reasonably. And because our seniors and their lives depend on it, that this gets done right. So thank you guys for being here. Thanks everybody for watching. And with that, the Aging and Long-Term Care Committee is adjourned. Thank you.